Good morning, North Texas. It's Dr. Toker, and today I thought we would throw together an informative video for the patients that come into both the spa and my office in regards to our response to preventing the spread of this new virus that's going around. As an update on numbers, in North Texas, there are 6 cases in Collin County, 8 cases in Dallas, and 3 cases in Tarrant County. So the spa is located in Tarrant County. Many of the patients who enter into that spa come from Ellis County, which has 0 cases, Tarrant County, which has 3. We might have a few from Collin County, that's Fort Worth, and we may have the occasional person that comes from Dallas. They have 8. A lot of what you see on TV needs to be serious. Obviously, it's a serious problem. Having said that, we are very fortunate. We live in wide open spaces here in Texas. This is why we moved here. And we're not crammed close next to people, which means there's a lot less likely chance that we're going to spread this disease in our normal activities. For safety, we are suggesting your normal activities should involve just like a little more space. So don't go to real crowded events and don't go to real crowded locations. I'm going to do my best to make sure my office is not a crowded location. And so we're going to limit 2 patients at any given time in a space. We want everyone to call ahead. So when you get to the office, and our office is now going to be located in the Med Spa. So that's 3150 East Broad Street, Suite 100. And it is the Skandii MedSpa. So whether you're a spa patient or you're a surgical patient, we want you to drive to the spa, park, call, tell us you're in the parking lot. We'll meet you at the front door. We'll let you in. We'll check your temperature. If your temperature is over 100, then we're going to make you go home. We'll wipe down that front handle of the front door for you so you don't have to touch a dirty handle. And then we'll take you immediately back to a procedure room for whatever procedure it is that you're scheduled for. Or if it's an office visit to see me in the surgery practice, straight back to an isolated room. I don't want a lot of people in the lobby and mulling about, and we're going to thin out the schedule, particularly for my surgical practice, because when I'm in clinic, we tend to see 30 or 40 people in a day, and we'll have to thin that out a little bit and utilize some telemedicine to try to prevent inadvertent close contact between people. Everything that you touch will have been previously wiped down with a bactericidal and a virucidal agent, whether it's Kleenex, alcohol, or something called Sidex, which is industrial strength. We use it in the hospital to sterilize between patients in the operating room. And so our surgical equipment and tables are wiped down with Sidex. Everything is disposable. All the instruments I use are disposable in my surgical practice. In the aesthetics practice, most of what we use is disposable, but obviously our laser and so forth is not disposable. And so that will get cleaned with alcohol and Sidex between each patient. And it does anyway, but just so you know, that's how we handle that. The one thing that I worry about are going to be the handles of the doors, like the bathroom door, a pen at the front desk that people might use to sign papers, the credit card machine, which everyone's going to wind up using to pay their copays and whatnot. So those are all the surfaces that we are going to wipe down. If we see you touch it, it's going to get wiped down after you leave and before the next person shows up. Okay, so everyone can have confidence that everything we're using has been terminally cleaned in between each patient. I do want to ask, though, that everyone kind of wait in the car. And the way the spa set up is kind of nice. I think it's going to be one of my favorite offices, but the parking lot is literally right outside the front door. So park, call, send signals or something that we know you're there. And then we'll make sure we're ready for you. We've got an empty room with your name on it. and then we'll either call you and have you come in, or we'll come get you and bring you in, check your temperature, make sure you're not sick and you didn't realize it, which could happen, and then get you straight back to your room. Does that make sense? Okay, so we are still seeing patients and we are still open. We're just being really squeaky clean about it. And a doctor's office is normally pretty clean anyway. It's the crowds reading newspapers in the lobby. That's what I don't want to have. And those are the changes that we're going to make that are significant. No crowds in the lobby. That front desk is going to have to get wiped down between each patient, especially where we take co-pays and make you sign legal documents. You know, it's a doctor's office. So anyway, so that's our plan for the spa and for my surgical practice. And we look forward to seeing you soon.